We're going to be talking a little bit about beards, actually, and the dilemma some are facing of having to choose between their faith and the work they do. Shumel Rahman decided to shave his beard just so he could continue working as a paramedic in Newcastle, and there are some hospital trusts suggesting people trim or shave their beard if they can because the PPE, personal protective equipment, fits better. Now, we're going to be speaking to Shumel a little bit later on, and I really want you to get involved with this as well, because I know there are a lot of proud Sikhs, proud Muslims, people with long beards in particular, who listen to the programme or that are in the family of you, in your family right now. If they're working on the front line, how would you feel about being told that in order for the PPE to fit properly, you're going to have to shave your beard or trim it? Is that something that you would be prepared to do? Is that something that is reasonable to ask? Or because this is such an unprecedented time with this pandemic, everyone has to make a little compromise? Would you compromise on your faith in that way, though? It's a layer that we haven't really touched on the programme before. We've been talking a lot about the lack of PPE or a lot of people from our backgrounds on the front line. But if you're being told to accommodate the PPE by shaving or trimming your beard, does that sit well with you? I want to know your thoughts. So as I mentioned, we're going to be speaking to Shumel in a few minutes' time. But first, SikhPA is here to guide us through what is a bit of a grey area here. So, morning, Sukhi. Are practising Muslims or Sikhs, let me get this right, are they being asked to choose between their faith and their job?
Well, it is a bit of a grey area, as you mentioned there, Cass. It's all to do with making sure NHS staff are given adequate protection when exposed to COVID-19 from what's called aerolised pathogens. And to you and me, that means germs spread through the air by someone either coughing, sneezing, or even talking. Now, we know that PPE, as you mentioned, has been a hot topic of debate for the NHS, a lack of protective equipment in some quarters, people making their own or even being given them by the general public. Now, the specific issue with this one is having the right PPE for the job. Now, the standard mask, or the FFP3 masks, to give it its official name, will not fit properly if a person has a beard or even a stubble. And we know that practising Sikhs shouldn't cut their hair, but with Muslims, it isn't as straightforward. Many NHS trusts and advice from the medical fraternity, including the British Medical Association, stipulate that health workers should shave off their beards for these masks to fit and therefore protect themselves and to protect the people that they're treating. Now, this has prompted some to seek guidance. We spoke to Dr. Gaggandeep Singh, the founder and president of the British Sikh Doctors Organisation, who outlines the issue, and apologies in advance for the poor sound quality.
Uncut hair and uncut beards, these are Geshadari or Radari Sikhs. They require a different type of personal protective equipment when working in areas where aerosol is being produced. Rather than wearing a FFP3 mask, they would require something like a respirator hood. This is in order to give them an adequate seal to keep them safe from getting the virus, and that would of course make sure that keeps their patients, their friends and families safe as well from catching the virus from them.
So in effect, Dr. Singh explains why it's necessary to have a mask fit properly with no gaps, essentially. It's like an airtight seal.
So, listening to Sukhi explain the situation and hearing there Dr. Gaggandeep Singh talk about the need for them to fit properly and not to have any excuses for why they can't, what do you make of it? So, Sukhi, is this a big problem within the NHS?
Well, look, I don't know the exact numbers around this. I wouldn't say it's a massive issue, but it's an interesting dilemma. And some Muslims or Sikhs may be uncertain of how to deal with this if put in this situation where this protective hood is not available. And let's be honest, a protective hood is very expensive. It also takes time to train with it. We will hear from Shumel shortly. He decided to shave off his beard, but he's not the only one who's faced this dilemma of whether to shave. I've heard of a couple of examples of practising Sikhs unsure of what to do when being asked to shave off their facial hair. I have actually read one article where it said that a practising Sikh gentleman had actually shaved off his beard. I tried to get hold of him, but unfortunately the author told me he didn't want to be identified. Now, another person who approached me, where after much discussion, This Sikh person was moved to another ward. So there is a degree of uncertainty here. Official advice, we spoke to the British Medical Association, and their advice is, and I quote, and I'll translate it because it's quite technical in a bit, but under the Equality Act 2010, a policy that may have a negative impact on a certain group is justifiable if it is proportionate way of meeting a legitimate organisational need, for example, health and safety. Now, in deciding if a requirement to shave is proportionate, your employer must consider the impact shaving would have upon you, for example, the psychological impact of abandoning a religious practice, and balance this against the needs to protect the health and safety of others. Now, if there is an alternative way of them being able to meet those needs, with a hood, for example, or moving them over to another ward, then it is unlikely to be proportionate. In other words, if there is a viable option, then opt for that. But what I want to focus on a little bit is the psychological impact, and that's the interesting bit here. And Dr. Gaggandeep Singh also highlights this.
In today's day and age, we do not believe that any doctor who wears a beard for religious reasons should be forced to trim or shave in order to practice. The other thing to remember is that any person who is forced to give up on their belief will be psychologically affected long term. And these psychological problems will only become apparent later on, after this pandemic has ended. We already know that a lot of our colleagues will suffer from PTSD after going through the pandemic. We are all seeing and dealing with quite a lot, and I'm sure for all of us, we'll never forget this time in our lives.
Well, okay, let's talk to our guest then about this, and that was Dr. Gaggandeep Singh there, talking a little bit about the psychological impact that this might have. Listening to all this, what are your thoughts here? Particularly if you are someone who is a beard, has a beard. If you are a Sikh person with a beard or a Muslim with a beard, would you be prepared to shave it off or trim it in order to still be able to do your job, still be able to, let's say you're working for the NHS on the front line, is that something that you are willing to do, or is that one compromise too many? Let's speak to Shumel then, who is a paramedic in Newcastle. We're also going to speak to Miranvir Singh, a doctor who works in Berkshire and North Hampshire as well. But Shumel first. So what I've been asking people about is whether this is something they would be prepared to do or not. It has been something you've done and been prepared to do as well. Tell us why.
Thank you for having us on. Could I just say Ramadan Mubarak first, and thank you to all the key workers for doing what they do. It was a massive step for me to shave my beard off. Big decision, and it took a number of weeks. I had to do a lot of research around it. So it wasn't an easy decision, but to protect my patients and family, colleagues and everyone else, I just felt like it was the right decision to make.
How difficult was it for you to make this decision, first of all?
I've had a beard for a long time. I've had a beard for nearly 15 years. So it was a very difficult decision. I had to consult a lot of people. I spoke to Islamic scholars locally and nationally. I spoke to the British Islamic Medical Association, different colleagues. And so I did do a lot of research into it. And if there was an alternative at this moment in time, I would have kept my beard. And like I said, it wasn't an easy decision to make, but what greater form of worship than to save someone's life, and ultimately that's what we're talking about, protecting people. So I think it's the right decision to make.
So you're so focusing on the positives there, which is great to hear. Do you think you should have been put in that position, though? Let's be honest. This is something that is your faith, your belief. Why is it that you're having to compromise that to carry on doing something which is protect people?
Mm-hmm. Well, I think I need to focus on the positives. I'm a positive type of person. If there was an alternative, which is what I'm going to seek in the future, and I'm sure they'll come available in my trust, and as soon as they do, I'll grow my beard back. Like I said, it is a difficult decision. It's not something that I did lightly. There's a lot of other doctors and nurses and healthcare professionals out there that have done the same, and it's not easy for any of us, especially with Ramadan just round the corner. It was a difficult choice.
Yeah, obviously. How is that going for you right now, Ramadan?
Alhamdulillah, yeah, it's not bad. I'm working night shifts, which helps. Yeah, it's a very strange time. Not going to masjid, not seeing family and friends, having to work together. Yeah, it's really strange.
I do get that. We've got Pamela on the line waiting. Pamela, hello. I will come to you in a moment. But Shamel, just a couple more questions for you on this first of all, really. What did the NHS or what did your supervisors say to you? Did they encourage you at all to shave the beard? Was it a decision you came to on yourself?
Well, everyone received a letter asking them to shave. There was a religious dispensation, which I did use for a period of time. But I just felt to myself, I was like, what is the right thing to do? What is the safest thing for everyone? And what's the best way forward? And as I said, I did a lot of research into it and spoke to a lot of the people. A lot of my friends are Islamic scholars and imams. And there's not a right or wrong answer to it. There's not a yes or no answer. It's an unprecedented time.
Yes, absolutely. I mean, as we say, it's a little bit more of a grey area for Muslims, but for Sikhs, it's something that is pretty much crystal clear, really. Let's bring Miranvir Singh in here on this now as well, who's a doctor working in Berkshire, North Hampshire. Morning, Miranvir. Thank you for your time.
Good morning.
I believe, well, the rules are pretty clear for Sikhs. Would you shave your beard?
For me personally, no. As a practicing Sikh, like you've already mentioned a couple of times, it's pretty clear for us. From Guru Gobind Singh Ji, our 10th Guru, one of their 52 hukams is that we should live and die with uncut hair. And so it's part of our Khalsa code of conduct, part of the Sikh Maryada, so like the way we should be living our life. And so it's pretty crystal clear, and there's countless evidence in our Sikh history of where Sikhs have always maintained to keep their hair even amongst different types of adversity that happened throughout our history. So it's pretty solid and set in stone. But then also from like a scientific point of view as well, I believe Suki mentioned earlier on about these hoods, and Dr. Gaggandeep Singh also mentioned about the use of the air-powered respirator hoods as well. Yes, they are difficult to maintain, and in terms of not maintaining, but they need to be, their power source needs to be charged, they need to be cleaned appropriately as well. But it's the fact that there's going to be people who, for example, have no facial hair, and the FFP3 mask, which, as you've mentioned, are the tight-fitting masks, they may not actually fit a person who has no beard. And so they themselves also need to make sure that they have access to these air-powered respirator hoods as well in order to protect them as well. So it's not just people with beards.
No, I get that. But for the moment, what we are talking about is people with beards, and I'd like to focus on that. I do understand these masks might not fit everybody as well. Pamela, please stay there. I will come to you, I promise. But Miranvir, I get that for you, it's very, very clear-cut. In no circumstance, not even a pandemic like this, should you shave your beard. At the same time, though, do you think that it is something that is putting yourself at risk, putting others at risk? Is there a little bit of you that can see that side of the argument?
I can see that side of the argument, and I can completely appreciate it, like our colleague who's just been on the phone beforehand and describing their dilemma and how it's unprecedented. That is definitely true, and there's going to be difficult decisions made from some people, but for people who are like myself in my position, it's quite easy and it's quite clear cut, and the different trusts that I work with have actually been really fantastic. For example, you're going to have your aerosol generating procedures like Gaggandeep Singh mentioned, and in those areas you need to wear the tight-fitting FFP3 masks, but in the rest of the department and other areas of the hospital, you only need to wear a standard surgical mask, which is the loose-fitting mask, and that makes no difference whether you have a beard or stubble or if you're clean-shaven. So, for example, some people can be moved to another area in that department, or they can be, for example, offered the powered air respirator hoods.
Okay, well, let's go to Pamela now, who has been waiting. She's called in. Pamela, morning. How are you doing?
I'm good, thank you. How are you?
Yes, I'm all right, thank you. I'm staying safe. Hope you are as well. Hope your mother is okay as well. Tell me, what are your thoughts on this then?
Problem, because I used to work in a hospital, and I think if you want to become a general surgeon, a heart surgeon, or whatever, any kind of surgeon, you know beforehand, yes, you have to be clean-shaven. So why go into that debate when you know, yes, you can't do an operation when you've got a beard, because for the safety of yourself and obviously the operating theatre and the patient. So why go there in the first place? That's what I'd like to ask. And also, you know that you can't, so why go down that avenue? Yes, I want to shave my beard, when you know already that you can't wear the surgical masks.
What would you say to that, Miranvir?
I'm just a little bit confused by the question, because there's actually quite a few surgeons, and when you see them, for example, in the States and this country, when they're performing spinal surgery, might be doing cardiothoracic surgery, they actually do wear an equivalent air-powered respirator hoods while they're doing those procedures, because they want to keep it very sterile.
I agree with that, but you're talking about the facial masks that they're not wanting to wear? Well, that they're told they're not to wear.
I'm just a bit confused by your question, because you said if someone is going into a specialism, then they shouldn't. Could you
they need to wear these
rephrase
masks
that
to
question?
know that's part of their job. If it's being a surgeon, they have to actually wear these masks, knowingly that they have to wear these masks to do any procedures. And if they're so against that, why are they going to that speciality?
Well, actually, I'm still a bit confused by the question, because there's so many ways around that, and people have had beards and they are surgeons and they perform those procedures on a day-to-day basis.
Yes, so they wear the masks then, yeah?
Pamela, hang on a second.
I'm not sure about your question.
Am I understanding it wrongly? Sorry.
No, it's fine, Pamela, it's fine. What we're talking about is, let's just focus on now and the coronavirus pandemic, if that's okay. Let's focus on this. Forget about what you've heard before or surgeons, etc. What we're talking about is people, medical professionals, whether they are doctors, surgeons, consultants, nurses, whatever. People who work in hospitals who have a beard, whether through religious reasons or not.
Right.
Okay. And then the standard PPE masks do not fit them with a beard.
Yes.
Right. So that is the dilemma here. For someone like Shumel, who is a paramedic, in order to carry on doing his job, in order to look after people, he decided to shave his beard. That was a sacrifice he was willing to make.
Yes, I understand that.
Yeah, okay. But for others, including Sikhs, such as Miranvir here, that is not something that he would want to do, because he does not want to cut his beard. It's not something that's part of his background, his beliefs.
Well, yes, absolutely.
And that's what we're talking about. And I want to know your thoughts. Do you think, what are your thoughts on this? What's going on for you?
It's a very difficult one, isn't it? Because, you know, you're following your religion, you're following your belief, and then you have to shave off your beard. Maybe they should step down from their job and do some other job, and somebody else take that place.
Miranvir, what do you make of that?
Again, I'm not really sure how much sense that makes, because for 13 years of my practice, this issue has never come about. And for other surgeons who have been working for 30, 40 years plus, they've been able to do the job they need to do. And especially more so related to this pandemic time, it's very easy to get around that. So I had thought of the situation if I had been a paramedic and I didn't have the hospital resources to my disposal. I myself would personally go and buy a respirator hood to use in the community, which are battery powered.
Right.
So I already thought of these. There's so many ways around it. We are a very rich country, which is almost the 7th richest country in the world. And we've struggled to even just get basic PPE, which is, for example, like the normal little splash-proof gloves and gowns. So when we're talking about masks and PPE, we don't even, in some hospitals at the beginning, we didn't have the basic equipment.
It's a difficult one, isn't it? Difficult one.
So it's not a case of, we should retrain when we are very experienced in what we do.
No, I understand
You'll find it very difficult to get someone with this level of expertise in things looking after someone who is,
absolutely,
for example,
I agree with you there.
with COVID.
Okay, Pamela, thank you very much for your call as always. Let's go to Dr. Gaggandeep Singh there, who we actually heard in Suki's report, who has now called up as well. Thank you for getting in touch with us as well. So, let's talk to you a little bit more about this story then. We've heard from Miranvir here saying it's not something he would be prepared to do. He thinks that there should be other PPE adequately provided. You've talked a little bit about the psychological impact here upon people in going forward. I want to ask you, what do you think about what Pamela was saying, and also for the likes of people like Shumel who actually have been cutting shaving their beards off to carry on their jobs? Aren't they not putting people at risk by doing that?
Thank you, Kasa. So hi, my name is Gaggandeep Singh. So I have a massive interest in this topic, and something that I have been working on a lot since the pandemic started through the organisation that I'm the founder and current president for the Sikh Doctors Organisation. And the main thing to say is that Sikhs and Muslims are in a different position. We spend a lot of time speaking to Muslim brothers. We have utmost respect for them, as do our Jewish brothers who also grow beards in some cases. I think the most important thing to understand is that in Sikhism, a Keshadari or Matari Sikh has taken this massive step in their life to decide that keeping their hair and their beard is part of their body, is sacred to them. And for most doctors or healthcare workers, actually our identity as Sikhs are linked to Sikhism means that has meant that healthcare work really comes naturally to us. The fact that we take care of people and represent our guru is massively important to us. So I think the question you asked, a very good question. Are we risking people by not wearing the right PPE? I think the first thing again to understand about this issue is there are many roles, as Miranvir said, within the NHS that do not require the respirator masks. So the FFP3s and the FFP2 masks that we hear about in the media a lot are respirating face pieces. So they have filters in them, and they prevent aerosol coming through to some extent. The problem with them are people with beards won't get an effective seal, so they can get the virus. The hoods can protect patients with beards because they seal behind the beard, and they are safer for those doctors or healthcare workers. The issue has been that getting those hoods is not always easy, and it's been very difficult for some people. We've had a number of people contact the organisation who've been stuck, but we've been able to work with them and their NHS trusts through them to make sure they move to areas where they can work safely. Mm-hmm. Now, sorry, go ahead.
No, so I was going to say, look, in an ideal world, everybody who requires a hood would have a hood, and everybody who requires PPE would also have adequate amount of PPE. But sadly, we don't live in that world. We are in this world. And with that in mind, if we are in a position where there are people who can't get the hood but are unwilling to shave their beards off as well, should they be put in front of patients or other people who could potentially get the coronavirus?
No, and I think we're very lucky in this country. We're not in that situation at the moment. From my practice, I work for a large trust, in NHS trust. I'm a frontline worker. And, we have found ways to protect our colleagues. This is, if we put the masks to one side, I know this is mainly about the masks, but if we think about just the points about the BAME that you put out earlier, how many staff are from the BAME community are working at the frontline at the moment? And possibly a lot of them are going to be moved to areas where they're at less risk. So we are not in a situation in this country where people have to take those steps. We're not in a position where there's only one Sikh in the whole country that can do one procedure and no one else can do it. For surgeons, so this is also unprecedented times. We never wore masks day to day. Surgeons do wear splash protection masks, so either visors or surgical masks. and obviously that's fine. They're not respirating face pieces. Surgeons can continue to practice, but with the virus now, this is going to be a problem. They're not going to be able to practice. The people that I'm really worried about at the moment are dentists in primary care. Dental healthcare workers who wear beards for religious reasons are really going to struggle, because the majority of the procedures that they do are aerosol producing. And we're working with dentists to work out how we can work around that. People don't want to shave their beards, and we hope that we do find a way around to protect them as well.
Well, Suk from Berkshire's got in touch about that, saying, I'm a dentist with a turban and beard, and dentists like me are concerned with the infection risk and PPE available out there in our jobs. We're very close to patients and thus at high risk to work. Dr. Gaggandeep Singh, Miranvir Singh, both of you, I've got one more text I want to read out to the pair of you and get a response. We'll do that in a moment, but we've still got Shumel Rahman. Shumel, here's a text for you, actually. It's an email, sorry, which says, Hi Casa, in regards for a beard for Muslim men, it is a matter of faith. Why not look for another job which does not require you to commit any haram actions, even if that job is in another country? I'm pretty shocked how the Muslim callers who have shaven their beards are not telling us exactly what the Imam and so-called scholars said to them in regards of this matter. There is no way a scholar cannot give a detailed answer to this issue. Shumel, a couple of questions for you there. What did the scholars exactly say to you, and what do you make of this emailer saying look for another job so you don't have to shave your beard off?
Well, I absolutely love my job. I love being a paramedic and helping people and treating patients. So there's no way I'd look for another job. I'm quite capable of completing my job as I am, with a beard or without a beard. In terms of the guidance from the Islamic scholars and their imams, I've already sort of addressed that and said there's not a clear-cut yes and no answer to it. Unlike the Sikh brothers out there, it's very crystal clear for them. It's not clear for us. And I did do a lot of research and speak to a lot of people about this.
Yeah. And you're comfortable with your decision, so that's what matters to you. It's everything else is between you and your God, Shumel. So there you go, fair enough. And thank you very much for your job, for what you're doing to protect us on the front line. It's been really good talking to you. That's Shumel Rahman. So one more message. This is from Neil in Milton Keynes, saying there is no religion bigger than humanity. So if you have to temporarily make adjustments to your beliefs, please do so. Don't let your religious ego put you and others in danger. Miranvir, I'll come to you on this one first. What do you make of what Neil said?
I can see it through what the gentleman seeing it through his eyes, but the core principle within Sikhi is actually to lose the ego and actually have no ego at all, and be rid of that. So, and through history within Sikhism, all our actions, as Dr. Gaggandeep Singh already said, is that we act for the best interest of others, trying to help them act in the right mannerism. And for example, in the healthcare system, we only want to do the best for our patients. We only want to maintain the best infection and prevention control procedures. And we are able to do that with the equipment that we have and with the systems that are in place, for example, in the hospitals that I work at, and able to actually function in our jobs to the highest level while maintaining good infection control procedures. So, I would say, yeah, we don't go into this with the ego that we think we are better than anyone because we want to keep our hair. The hair actually allows us to connect on different spiritual and belief levels that allow us to actually practice to a better level. So that would be my rationale for that.
Miranvir, thank you very much for your time there. That was Dr. Miranvir Singh, also Shumel Rahman, and Dr. Gaggandeep Singh there as well.